Thank you for taking the time to review this online continuing medical education module on intrauterine contraception. We hope it will improve your knowledge so that you can feel confident discussing this form of contraception with your patients. Why is intrauterine contraception important? Let's start by discussing the unmet need for reliable contraception in Canada. A large proportion of pregnancies in Canada are unintended. Many of these are due to the challenges of using a contraceptive method correctly and consistently. Women spend a large portion of their reproductive lives trying to prevent pregnancy. Unintended pregnancies will often result in abortion. There are several barriers to the correct and consistent use of contraception. Several are listed here. There are likely even more than are listed. Not all contraceptive methods are created equally. Different methods have different levels of effectiveness. This can be due to inherent properties of the contraceptive method itself, or to imperfect or inconsistent use of the method. In this chart, you can see the failure rate of different methods with typical use in the blue lines. The percentage of women using each method is indicated by the green lines. Unfortunately, the most effective methods are not always the most widely used. Combined hormonal contraceptives can be particularly challenging to use consistently, yet they are one of the most popular forms of contraception. This graph demonstrates that women may overestimate how consistent they are in their use of oral contraceptive pills. In this study, participants were asked to record how often they thought they had missed taking their daily OCP. An electronic device within the pill package monitored how often the pills were taken at the right time. Many women perceived that they missed none or only 1 or 2 pills per package, but the electronic device demonstrated that many women were actually missing 2, 3, or more pills per package. Interestingly, this discrepancy actually got worse over the course of the study, demonstrating that many women were missing 3 or more pills per pack by the 3rd pack. However, they consistently underestimated the number of pills they were missing. Intrauterine contraception is one of the most effective methods of contraception because it does not require much effort by the patient to continue using it effectively. Unfortunately, there are some myths that exist about the safety and efficacy of intrauterine contraception, which could limit the use of this method if patients or healthcare providers are concerned about these myths. We will attempt to address these myths in the next several slides. Some patients and healthcare providers may be concerned about future fertility after using intrauterine contraception. Patients can be reassured that this method of contraception has no impact on their future fertility. This graph demonstrates the return to fertility in IUD and non-IUD users. You can see from the curve that IUD users are equally likely to conceive a pregnancy in the 12 months after discontinuation as users of other methods. Nulliparity is not a contraindication to intrauterine contraceptive use. In fact, many authorities on contraception, adolescence, and women's health advocate for intrauterine contraception methods to be offered as first-line methods to adolescents and other Nulliparous patients. A persistent myth about intrauterine contraception use is that it increases the risk of developing pelvic inflammatory disease, or PID. This may have been true of some older types of intrauterine contraceptives that were used decades ago, but for the current devices that are available in Canada, there is no increased risk of PID in long-term users of intrauterine contraception. There may be a slightly increased risk around the time of placement of the device because vaginal bacteria may be introduced into the upper genital tract. Women should be counseled about this small increased risk in the first 3 weeks after placement and counseled to seek medical attention should they develop any signs or symptoms of infection. After the first 3 weeks, the risk of developing PID returns to baseline. Patients should be encouraged to use safer sexual practices, including the use of barrier methods, to reduce the risk of acquiring a sexually transmitted infection. As sexually transmitted infections, with or without the presence of an intrauterine contraceptive, will put them at risk of PID. This graph demonstrates the slight increased risk in developing PID around the time of intrauterine contraceptive placement and shows how it returns to baseline after the first 3 weeks. Some patients and healthcare providers are concerned that the pain of intrauterine contraception placement will be severe, and they avoid considering this contraceptive option due to this concern. In reality, most patients describe the pain associated with placement as mild to moderate. Many women will experience some crampy pain in the days or weeks after intrauterine contraceptive placement, but this is usually well managed with the use of non-steroidal anti-inflammatory drugs. This slide demonstrates the pain that is reported with the placement of 2 hormonal intrauterine contraceptive systems. Patients and healthcare providers may have concerns about perforation of the intrauterine contraceptive. While perforation is a risk in patients who have an intrauterine contraceptive placed, it is a rare complication. Most perforations will be partial, for example, a slight embedment of the intrauterine contraceptive into the myometrium, and these will often be asymptomatic and are not harmful. Complete perforations are rare. Good technique while placing the intrauterine contraceptive, including the use of a tenaculum and a uterine sound, will decrease the risk of perforation. Many healthcare providers and their patients will be concerned about the risk of ectopic pregnancy with the use of an intrauterine contraceptive. It is very important to remember that the overall risk of ectopic pregnancy is significantly lower than the risk of ectopic pregnancy in women who are not using contraception, or in those who are using a less effective method of contraception. This is because the risk of any pregnancy is extremely low with an intrauterine contraceptive in place, and therefore the risk of an ectopic pregnancy is also very low. Women having an intrauterine contraceptive place should be counseled about the low risk of pregnancy, including ectopic pregnancy, with an intrauterine contraceptive in place. They should, however, be made aware that if they do have a contraceptive failure with the intrauterine contraceptive in place, that pregnancy could be ectopic, and they should seek medical attention if they find that they are pregnant with the intrauterine contraceptive in place. This graph demonstrates the comparable rates of pregnancy and ectopic pregnancy between intrauterine contraceptive users versus women who do not use contraception. The risk of ectopic pregnancy is substantially lower in intrauterine contraception users compared to women who are not contracepting. In the next few slides, we will describe many of the features of intrauterine contraception and help you develop your knowledge and confidence in counseling patients about the use of intrauterine contraception. Intrauterine contraception is the most effective reversible form of contraception available to women in Canada. This graphic demonstrates the failure rates of various methods. You should focus on typical use failure rates when counseling patients, as that is the most realistic failure rate that patients will experience. There are very few contraindications to the use of intrauterine contraception. The mechanism of action is different between the two types of intrauterine contraceptives. With levonorgestrel intrauterine systems, abbreviated LNG-IUS, the main mechanism of action in preventing pregnancy is the thickening of cervical mucus that results from the presence of the progestin. With the use of copper intrauterine devices, abbreviated IUDs, the main mechanism of action is the incapacitation of sperm that is a result of copper ions within the uterine cavity. This is a list of the various types of intrauterine contraceptives available in Canada. This graphic demonstrates the differences between the three types of levonorgestrel intrauterine systems that are available in Canada. Many women will choose the levonorgestrel intrauterine system for its reliable contraception and because of some of the beneficial side effects, such as reduced menstrual bleeding. The LNG-IUS is a very safe and effective method of contraception, but it does come with a few potential risks or undesirable side effects. While a small number of women will report hormonal side effects from the low dose of levonorgestrel in the LNG-IUS, such as breast tenderness or acne, most women will have minimal or no hormonal side effects. The systemic absorption of levonorgestrel is very low, as demonstrated in this graph. Women can be reassured that hormonal side effects are rare with the use of the LNG-IUS. There are several different types of copper IUDs available in Canada. All are approved for contraception, and most are also approved for emergency contraception. They come with varying durations of use. Most are very affordable, typically under $100 per device. Copper IUDs have many benefits, including reliable contraception. They are often more affordable than hormonal intrauterine contraceptives for women who do not have a benefit plan that will help pay for their device. They are also an excellent option for women who wish to avoid all exogenous hormone use, but still require reliable contraception. The risks associated with copper IUD use are very similar to those for the levonorgestrel intrauterine system. A side effect that can be seen with copper IUDs, which is not typical of the LNG-IUS, is a potential increase in menstrual blood loss and/or dysmenorrhea. The following slides include some tips on how to counsel patients on the use of intrauterine contraception. A good way to begin a conversation around contraception is to address a patient's reproductive goals. How soon may she wish to consider a pregnancy? How upsetting would it be if she were to conceive an unintended pregnancy? While all patients may benefit from a discussion of the advantages of intrauterine contraception, for women who anticipate trying to get pregnant in the near future, or for whom avoiding pregnancy is not very important, you may wish to discuss short-acting reversible methods. For women who are not intending to get pregnant anytime soon, and for whom an unintended pregnancy would be devastating, emphasizing the effectiveness of intrauterine contraception is a good strategy in your contraceptive counseling. This counseling checklist will help you to counsel in a quick and efficient, yet thorough manner in your busy practice. The Society of Obstetricians and Gynecologists of Canada provides patient counseling materials, including a sample consent form for women who choose to have an intrauterine contraceptive placed. And in the next slide, recommendations for patients after placement. When describing to patients what to expect during the placement procedure, it is important to alleviate anxiety while accurately communicating what she will experience and what the risks of the procedure are. Managing expectations for the post-procedure time is important also. Women should be made aware of the expected changes to their menstrual flow. They may have reduced flow with the LNG IUS, or they may have increased flow with the Copper IUD. In the first several weeks and months with either type of intrauterine contraceptive, although more prominent with the levonorgestrel IUS, women may experience irregular bleeding and spotting. They may also experience cramping. Discomfort should be managed with nonsteroidal anti-inflammatory drugs. It may be helpful for the patient to take a nonsteroidal anti-inflammatory prior to the placement procedure to minimize the cramping she will experience afterwards. After placement of an intrauterine contraceptive, patients should be offered a follow-up visit. If she has questions or concerns prior to the scheduled follow-up, you should provide her with instructions on how she can be assessed sooner if needed. In summary, intrauterine contraception is a great option for women who require highly effective and safe contraception. Increased use of intrauterine contraception is likely to reduce the rate of unintended pregnancies in Canada. We hope that after completing this online continuing medical education module, you have increased your knowledge of intrauterine contraception and that you feel more capable of dispelling myths and more confident counseling patients about the use of intrauterine contraception.